And for a lot of us, hypertension is extremely important and always kind of under noticed in a lot of populations. And so one of the aims of this was to really bring attention to hypertension as a problem and to make people aware of something that, as everybody knows, kind of passively destroys a lot of lives and takes loved ones far too early. And so that was kind of the motivation for this. But of course, the motivation is only so much, and we need the assistance of wonderful community leaders like those at Temple of Praise. So we thank you all so much. Of course, Dr. Katz and Dr. El-Bayoumi and everybody else who makes this operation possible. We can't thank you enough.
So what year medical student are you? Tell us about you.
Oh, we're all first years. We're very enthusiastic.
Okay, so first year medical students. And so tell us a bit more about this program. Is this just like come get your blood pressures checked and then go home, or what is the plan with this partnership with Temple of Praise?
I can go if you want. Yeah. So the partnership is.
What's your name? What's your name? Introduce yourself.
My name is Will. I'm also a first year medical student. I'm friends with Bridget and Jacob, and we're super appreciative of you guys inviting us to your events. The goals of this is to do a blood pressure screen and to teach CPR, but also to inform people about why blood pressure is important and things that you can do to lower it if it's high to hopefully maximize your long-term health.
Okay, and Bridge, do you want to introduce yourself?
Hi everyone, my name is Bridge. I'm one of the first year medical students as well, working with Jacob and Will. I just want to start off by saying thank you to Bishop Webb for hosting us for this event, and Dr. El-Bayoumi and Dr. Katz for helping us get this project underway. I think as a whole, we hope to get something out of this project where we can make a longstanding effort to help the community at large, bring awareness to hypertension and give them the tools and the education necessary so that they can have a better control over their own health and hopefully bring some positive health outcomes in many lives. Like Jacob mentioned, hypertension, unfortunately, is a longstanding issue with people and takes people far too early. So we hope to make an impact and, forge a positive outcome for people.
Okay. Now, Bridge, I've known him before he existed because I've known his father. His father and I did our residency training together, and his father is a cardiothoracic surgeon. So it's nice to see you continuing. And then there is Pastor, who's also an audience member. Is that right, Pastor, from India?
Pastor, my name is Pastor Gondapatri Venkatrao, DK Webb Global Ministers India Congregation Director in India, Gondapatri Venkatrao.
Well, we're so happy to have you. So, let's start off with Jamie Foxx, because it looks like he had a stroke. They're finally beginning to say that that's what's happened to him. And just to bring everybody up to speed, Jamie Foxx is a very talented actor, musician, and gosh, it's going on almost a month now. He was rushed to the hospital. Emergency. There was a lot of secrecy about what was going on with him. I think today they confirmed that he is in a rehab facility in Chicago, which is for stroke rehab. So please, because I think a lot of people, when they think of high blood pressure, many people understand that that can be related to stroke. But Dr. Katz, walk us through what happens when the blood pressure gets so elevated that it causes stroke. How does that happen?
So hypertension can affect multiple organs, but when it comes to the brain, you can really burst a blood vessel. The blood vessels can be really tiny, and with that high pressure, the blood comes out of that blood vessel and damages the brain tissue nearby. And as a result, depending where it hits, it can cause a variety of different neurologic problems. So we certainly want to prevent that, because the worst thing about hypertension is destroying quality of life. And for people to end up to be paralyzed, to be in wheelchairs is terrible when we have the opportunity to really intervene and get people educated. Make sure that they are interacting in a vigorous way and purposeful way with their healthcare team. So you want to really avoid stroke as much as possible. You've already mentioned heart disease and heart attacks and kidney damage and can even go dialysis, but this stroke is so devastating when it happens.
So maybe we should just talk about what is blood pressure and what does it mean to have high blood pressure? I mean, let's just get back to basics. What does blood pressure mean? There are two numbers that we get, and hopefully everybody that's listening in should know what their blood pressure readings are. And if you don't, please come out on Thursday to the Temple of Praise so that you can know what your blood pressure numbers are, because that's very important. So what are those two numbers? Dr. Katz, do you want to take this one?
Just briefly, you've been used to it. When you go to get your blood pressure taken, there's the upper number and the lower number. And the upper number is the blood pressure when your heart squeezes and hits the blood vessels. And then the lower number is when the heart has relaxed. And both pressures have an impact on the body, on the organs of the body. You want to get some blood pressure around to get the organs of the body getting good oxygen and blood supply, but you don't want to traumatize them with that. When it comes to what are the normal blood pressures, we've been more careful and really had more distinct goals. And one of the things I want our community to understand is whether they're at what their goal for their blood pressure should be and what to prevent these things. And in that regard, I usually focus mostly on the upper blood pressure. The other lower number is important, but they tend to track each other. And I would start off by just focusing on the upper blood pressure. And that's the one where we are now trying, first goal is to get 80+% of the blood pressures 140 or lower. But we have also learned in the last 5 or 10 years that getting it down to 130 on the upper blood pressure is even better. So lower is better. And we can talk about that with my students and to people individually to really make sure you can understand what your blood pressures are. And we'll talk about how frequently the blood pressures and how to technique for taking blood pressures, how to get a blood pressure cuff and how to keep track of your blood pressure numbers to communicate with your medical team.
Mm-hmm. So in other words, just to recap what you said, the blood pressure, you've got your heart, which is a pump, and it's got other functions too, but its main function is to pump the blood to the rest of the body. And you've got to get it just right. It's kind of like Goldilocks. If it's not enough, then you're not getting enough blood to the vital organs. If it's too much, then that could make a blood vessel pop and it can cause damage to the various organs, but you got to get it just right. And so that sweet spot for most people, first getting it less than 140 for that top number, getting it less than 130 would be even better. And in some cases, like with younger people, we really want it even lower than that. And the analogy that I use is the reason blood pressure is not good on the heart is, let's say that I was lifting weights, okay, which is I'm putting a lot of pressure and I'm making the muscle, I'm making it work harder and harder. Well, that's fine for my arm, but what happens if it's the heart? The heart then starts to expand and get thicker, and that can lead to early heart failure. I know I'm saying it in a very simplistic way, but our bodies are very forgiving, but we have to make sure that they're in balance. Too little is not good, too much is not good. So Raj, what are the different organs that the heart supplies? When we say vital organs, what are we talking about?
So things that we're talking about when we talk about the vital organs, things like the brain, the kidneys, the intestines, those are all a part of the essential vital organs. Even the heart itself needs to have blood going to it. So like Dr. El-Bayoumi mentioned, it's a fine balance of being able to get the blood to those organs especially things like the brain and the kidneys, but without overdoing it. You don't want to push too much blood to those organs because of the risk of damaging those organs. So those are some things to keep in mind when understanding hypertension.
Now, one thing that I tell my patients, there's a reason we call high blood pressure the silent killer, because I think that actually Jamie Foxx was on the set acting, and then boom, he had a massive stroke. So he probably wasn't having any symptoms. If a person were to have symptoms, what are the symptoms they may experience with high blood pressure? Anybody?
Yeah, I mean, maybe Dr. Katz would be best to answer this question, but one of the things that's so interesting is unless it gets really high, like above 180 or 200, you usually don't feel anything. You might maybe feel a little anxious, a little squeezing in the chest, but at really high blood pressures, you can have changes in the eyesight, visual changes. A lot of people say that they have horribly kind of stiff neck, really kind of odd stuff. So the point being is you want to control it, and you want to control it early so that you don't have to be exposed to that kind of blood pressure and, hopefully have a much longer shelf life, being healthy and happy and not disabled with your family, your loved ones, and of course your community of faith.
So just because you feel fine doesn't mean that your blood pressure is at sky high. Is that right?
No, absolutely not, Dr. El-Bayoumi. And you and Dr. Katz have been great advocates of this, where we see people that are and a lot of times in good spirits, they're happy, they're joking around, they have blood pressures that are dangerously high, such that if they continued at that rate, their likelihood of a disabling event like heart attack, stroke, or anything in between is dramatically high and absolutely needs intervention. So that's the beauty of this kind of program, is that we want to catch this early so that we can direct you to the right centers of care and you could get that under control.
I know that sometimes people will talk about feeling like they have a headache that might tip them off to the fact that their blood pressure is up. But again, it's called a silent killer for a reason. And I think that's really the important message here, is that you have to know your numbers. One thing that I find a lot of people don't know is that you can actually have silent strokes too. If you have multiple tiny strokes, when people become confused or lose their memory and have something that looks like dementia, well, one of the causes can be multiple small strokes over time. And that's what happens did you know that, Bishop?
No.
Yeah, it's actually very significant. And actually, when you take a look at the brain, it kind of looks like Swiss cheese, because over time, the blood pressure being elevated may not have caused a huge stroke, but it's picked off over time small parts of the brain, and that can impact function. Dr. Katz, would you like to speak to that a bit more?
Well, there's no question that we will see people who have neurologic problems over time, and only to find out that they'll do a brain scan or something, and you'll see these little spots in the brain where you've had some damage without having had a sudden weakness or such that would ordinarily manifest as a big severe stroke. So little ones add up over time.
And so it's important to realize that even a cause such as dementia, if it's related to blood pressure, that is a preventable, one of the preventable types of dementia, is getting your blood pressure under good control, making sure it's elevated. So we've talked a little bit about the brain. We've talked a little bit about the heart. What happens with the kidneys? Why does high blood pressure damage the kidneys?
All right, we'll take it, or else, whoever.
So the kidneys serve as a filter for the blood. And so when you have too much blood flow going through the kidneys at too high of a pressure, it can damage the filter, that the natural filter that the kidney serves in the body to get rid of the things that you don't want from the blood and to retain the things that you do want in the blood. And so what happens with hypertension is over time, you slowly wear away and wear down this filter to the point where the kidneys are no longer able to correctly filter the blood. And you start to lose things that you don't want to lose, and you start to retain things that you don't want to hold on. And so that can be a problem because then you start to have changes in the blood itself, and that could be dangerous for the other organs that were mentioned earlier, like the brain, the heart itself, the lungs. So it's all necessary to keep your blood pressure under control to prevent damage to those kidneys.
So some of the signs of kidney failure, kidney problems, if you start to retain fluid in your feet and ankles, if you can even get puffiness around the eyes, those are interestingly similar kinds of signs and symptoms for people who may have some heart failure as a result of blood pressure affecting the heart. They can have difficulty breathing. They can have swelling in their feet and ankles. And I'm the general internist in the group. And so I often get asked the question, what causes high blood pressure? So Dr. Katz, what causes high blood pressure? Do we know?
So we know in some people, but in most patients, we don't know. It just happens. And it's when we have almost 40% of the population in the United States, and particularly in our inner city and African American population, a very high incidence of hypertension. You just don't have a reason. There are a small, less than 20% of patients who may have some hormone abnormalities or some blood vessel narrowing abnormalities that cause high blood pressure. So when we see a patient for the first time with high blood pressure, we'll do some simple tests and see, looking at their kidneys and their hormone values and such. That's something that a routine physician will do. But most of the time, we're going to end up seeing nothing in particular that is a cause for it. And it runs in families as well. So we have to be careful about it. Also, it is more common in people who are overweight and more common in people who have diabetes, which is just a double whammy on the body's ability to function.
So I'd like to talk about some diseases that people don't necessarily know are related to blood pressure. So did you know if you have sleep apnea, that can push your blood pressure up? It can also make blood pressure much more difficult to control. So what's sleep apnea? Ask anybody, or if you see a relative or a parent or a family member that's having snoring, it's not enough to snore. It's when they can't catch their breath. And the reason that is difficult is that it actually causes, you're not getting any rest when that happens. Your body is being deprived of oxygen, both the brain and the heart. And so that means that the heart is working harder to basically maintain all of the functions. So whenever I see somebody that I've never seen before and they have high blood pressure, I always ask them, do you snore? Do you wake up with a morning headache? Do you wake up to urinate several times at night? Do you have a very, very dry mouth when you wake up? Those can be signs and symptoms of sleep apnea, which we can actually do some tests for and treat. The second thing I ask about is alcohol intake. People often think that alcohol is just, hard liquor. No. Alcohol means beer, wine, or hard liquor. If you have a shot of something, that's actually the same as a beer. Why? Because even though the shot is much stronger, you make up for it in the volume of a beer. So they're equivalent. So is a glass of wine. So one shot equals one glass equals one, can or bottle of beer. And alcohol can have significant impacts on the brain and the heart, and of course, as we know, the liver. But what happens is that it can also cause problems with your blood pressure. Especially what will happen is I will see somebody in clinic, and when people are coming to the doctor, sometimes they will not eat for watch what they're eating for the last couple of days, or maybe even stop drinking alcohol. And some of the alcohol withdrawal can make their blood pressure go up. So I always ask about alcohol. The third thing is a lot of medications that are available over the counter like BC powder, right? Like Advil and aspirin and Aleve and ibuprofen, that can have a negative impact on the kidneys and also can affect blood pressure as well. And then finally, to your point, Dr. Katz, about diabetes, on average, if somebody's diabetes is not well controlled, it will take 4 blood pressure medications to control their blood pressure. So if you're not being well controlled for your blood pressure, you got to look to see if your diabetes is well controlled, because they feed off of each other. And then, as Dr. Katz mentioned, there are very, very, very rare tumors, not cancers, that can cause high blood pressure. And guess what? My sister had one. So on top of the kidneys sit these 2 pyramid-shaped structures called the adrenal glands. Those are the ones that secrete adrenaline. And she had a benign tumor that was secreting too much of that hormone. That's a very rare thing. We read about it in medical school, but we never really get a chance to see it. She was on 4 medications that were not controlling her blood pressure. And the thing that was kind of confusing things is that she's chunky, she's overweight. So kept thinking that it was related to her weight. And then guess what? It wasn't. She had the tumor removed. Now she's on no blood pressure medications. So that's a rare cause, but it is something worth looking into, especially if you're really young and if the usual treatments of blood pressure do not work. Anything that anybody else would like to add to that?
Well, I wanted to say something, Dr. Gigi, and wanted you all to address this as physicians. Why does it seem that hypertension, high blood pressure is more intrinsic with people of color? Do you think that social stresses could be part of the issue, as well as our social determinants to health? Why is it that African Americans are known to suffer so much? Because I know a lot of them who are underweight, but they have severe high blood pressure. Could you speak to that, as well as the second part to my question that some of our viewers want to know is, what should they tell their doctors? Because a lot of times you go to the doctor and they take your blood pressure. It may not be as elevated, but what should the doctors be looking for? What should we make certain is added when we get our physicals, when they do our blood work, that we may see some precursors to some issues?
Well, I would say let's start with the second question first, is what should you walk away with from your doctor's visit? First of all, you are your own best advocate. Okay. And, we've got some issues with our health system, right? Everything is rushed. Sometimes, people, sometimes the clinicians may not be at their best. We know that this is an issue. Let's just put it out there. Racism can impact the physician or the clinician-patient relationship, but you're your best advocate. You should know your numbers. So when you walk out, you should know what your blood pressure numbers are. You should be keeping track of those numbers. You should know what your cholesterol is, the total, the good and the bad. And at a certain age, you should know, if you have diabetes, what your A1C is. And this is what I would say to people. The majority of people who go into the doctor's office, we're not at our best. Many of us get very nervous. For me, it's not so much a doctor, it's more the dentist. And so whatever questions that I might have, they will just fly right out. Write down your questions. Write down, make a list of what you want to discuss. If you feel like, oh, I just can't do that, bring a friend, bring a family member. It is very important for you to know about your health. And the example that I use is this. When we go shopping for a car, or we go shopping for a new piece of clothing, we spend so much time, right? We ask so many questions. We ask about the price. This is our health. This is much, much more important than those material items. We should be the ones to know, oh, you know what? My last cholesterol was 182. My A1C was this. That's very, very important. So, and it shouldn't be like, oh, I don't have time. No, these are crucial. This is crucial information. And frankly, if you don't feel like you gel with your clinician, find somebody else, because you
Find
really need to be
somebody else.
able to have those conversations. Yeah, there are other physicians or other nurse practitioners or PAs, or, it doesn't have to be a physician necessarily.
Mhm, mhm.
And Dr. Katz, in your review and understanding of the literature, has there been any explanation to say why African Americans specifically have higher rates of high blood pressure? You're on
He
mute.
gotta unmute himself. You gotta unmute yourself.
Sorry. Yeah, it's not really that well known. We certainly know that Africans particularly from West Africa, have a lot of hypertension that they have had done due to their salt in their diet. But there's something that is genetic about that, and that may be a little bit of the altered sensitivity to some of the natural hormones. So you might not even see it in their blood tests necessarily, but it clearly is a big, big problem.
So I have to tell you, my father has high blood pressure, and he will say, I'm hypertense. You guys are getting on my nerves. That's why my blood pressure is elevated. And I think the whole issue, Bishop, of the social determinants of health and and stress and all that, how that impacts our health. I think that this is something that the medical establishment, quite frankly, has tended to kind of say, no, it doesn't play a factor. But guess what? Just this year, the medical establishment said stress is a carcinogen.
Wow.
Yes, this is the first
Cancer cause.
time stress is a carcinogen. So I think as we begin to understand those social determinants of health, which I'm going to ask the medical students to help us talk what that is and why they're so important, I think that we will understand them a little bit better. I will tell you, not with high blood pressure, but in other illnesses, let's say breast cancer. It used to be that women in Japan had a certain level of breast cancer. And then when some of them moved to Hawaii, their risks went up. And then when they moved to the mainland, their risk went up. And so that was felt to be related to the diet, right? The dietary changes. Unfortunately, the Western diet is no longer just in the West, right? It's been exported. So there's McDonald's and Kentucky Fried Chicken and potato chips and all these things worldwide. But that's an example which really shows you that, at least in this particular example that I showed or shared, it is diet. But do any of the medical students want to help educate us on what those social determinants of health are?
Yes, definitely. So one of the large ones is access to a medical provider in certain areas. So like we know that certain parts of a city, particularly Washington D.C., it's harder to find a primary care physician, and the average person just doesn't really know enough about medicine to like be aware of like what's going wrong. So it's extremely important that they have access to someone who could monitor their health and advise them in a correct way. So that kind of goes back to what you were saying earlier, Dr. Albayumi, that it's really important to maximize every single visit in terms of like writing down questions that you want to ask, especially if you find it hard to access a physician.
Okay.
And I think that's great, Dr. Gigi. I want to add here, because they're medical students, I think what we need to do is make certain we stop being dismissive to certain patients, especially women, because I get that a lot, saying, Bishop, they treat me dismissively, like I'm just, something is wrong with me, and I'm trying to tell them what I'm experiencing in my body. So I think it's great for medical students who are going out to become physicians, that physicians also have to take the time to listen to your patients, also have to take the time to let the patients explain, the way that they're feeling. Because I've been diagnosed with some things that diagnostically the numbers didn't show that I had. And until I kept being persistent, and then they went further and did some more diagnostic testing, then they gave me a different diagnosis. So I think that's critical for medical students, because we're dismissed a lot, especially women.
Yep. Yes, Dr. Katz.
Unmute yourself.
Maybe you can just stay unmuted, huh?
I'm trying, but and the other things are the stress on what kind of adequate housing one has, what kind of access to food one has, particularly healthier food, and some assistance with diet and also ability to have safe exercise. I saw a patient today. Her blood pressure has been great, and then her blood pressure shot up. When I talked to her today, we had a really heart-to-heart talk, and she said, well, two things. While my blood pressure was high, my grandson had just been shot. My knee has just been injected because of pain. There are all these life things.
Yeah.
And we as physicians have to know their circumstances and what's happening, because today her blood pressure was fine again because things were settling down. And so we have to really get to know people of what their situation is and some of the stresses that some of us just don't know to experience.
Well, I mean, we call our profession a healing profession, and we feel that we are called to this, much like you, Bishop, in terms of your ministering. And why we came to this profession in the first place is that because of our deep love of human beings and the willingness to serve. But unfortunately, sometimes the system jades out those aspects of ourselves. And the most important thing is to connect to another human being. It doesn't take any time to say, hello, how are you? What do you do for a living? What's going on with your family? But I want to come back to the social determinants of health, because oftentimes people think that the how healthy they are has to do with access or seeing a doctor. Well, we're important. About 20% of your life expectancy can be attributed to coming to see us, but 80% is due to your education, your level of education, the economic health of the neighborhood you live in,
Wow.
the zip code,
Wow.
the quality of the water, the air that you breathe,
Wow.
the food that you eat, these other stressors, racism, these attitudes. So, Bishop, I'm going to share with you something. When I was at your church, maybe in October, I had interviewed a number of leaders there, and including one who was the principal of an elementary school. And she told me that she could tell which kids, of the kids that she had in class, which kids lived in neighborhoods where there was lead poisoning. She said she knew because of their behavior and academic performance. So a child, in the United States of America, in Washington, D.C., is exposed to lead, which is completely preventable, right? So she says that when she goes to the other, they have, I guess, principals meetings, and she shares this with the other principals. There's like, oh, there's a problem with lead in DC. Well, yes, as a matter of fact, there is in Southeast. And even having access to a doctor, like coming to see a doctor at whether it's Georgetown or Howard or GW, 3 bus rides.
Yeah.
3 bus rides, right?
Yeah.
Or the competing priorities, and Bishop, you can speak to this more than anybody else. I mean, mental health. How can you even pick yourself up, get dressed, go to a doctor if you are just in crisis?
Absolutely.
And you and I have spoken about how this has really impacted people and has had a very significant impact on their health. So, and you just mentioned, Dr. Katz, the gun violence that's there. And so, Bishop, I'm going to ask you a question. Please share with us what you're seeing in the church in terms of the mental health situation.
Well, of course, mental health, illness, signs, symptoms of mental health issues begin to exacerbate during COVID-19, the onset, even though they say now we're post-pandemic. But, You know, we use the word epidemic, we use pandemic, we use all these things to say that things are going on all around the world. But when you think about impoverished neighborhoods, for them, it's always an epidemic. There is always an issue and major problems that seems to be insurmountable. And so you have all of these mental health problems that are already gone undiagnosed, they exacerbated, and thereby it pushed a lot of people to the edge. And what we're seeing in the church, we're trying to offer hope, we offer prayer. Those are the spiritual things because we're spiritual healers. But the people are also physical creatures and they have to leave the church building and go home and live. Like Dr. Katz said, someone's child was shot. I just saw today some child was laying in their bed at home and the bullet came through the window and shot the child through the window in her bed. You know, so for us, it has always been that. And so people don't realize that anger, anxiety, all of those are mental health issues. And now it's exacerbated to the point, Dr. Gigi, that people will come into church, they've lost hope, they're angry, they lash out at one another. You know, they are very cynical. They're very pessimistic because to them, nothing is changing in their neighborhood. To them, everybody has forgotten them. To them, COVID has robbed them of family members, where even financially they couldn't bury their family members. They didn't have money. So the church is seeing a lot of that, which makes our job, you know, more challenging in that we're trying to bring them around mentally to try to help dissipate some of the anger, the anxiety, not to mention all these kids that really, Dr. Gigi, I think is really unfortunate. It's very sad. A lot of these kids are suffering from PTSD. If every other day you see your friend laying on the ground dead, that's like being in Afghanistan, Iraq, somewhere in the war, in the battle zone. That's what it feels like to them. That's traumatic. It is traumatic. And so in the church, it has become a lot more challenging, not only because of the mental health issues, but just to get them back in the building post-pandemic, because of course we couldn't come together and worship together. And now that churches can open and we aren't limited, but people have become so accustomed to sitting at home and watching it. So now it's even more challenging because they're committing suicide, they're homicidal. And so, you know, you have to couple all these things. You have to not just approach it from a spiritual perspective. You have to approach it from a practical perspective, from an educational, from a mental health professional, psychiatric, you know, and some people we have recommended, okay, want you to go see a therapist because, you know, as much as we're praying, want you to go see a therapist because we don't want you to come into the church and become suicidal and homicidal and come in with a gun and even start shooting here because I'm feeling hopeless. I've lost all hope and anxiety and everything has just overwhelmed me. So it's very, very challenging in this hour, Dr. Gigi, Dr. Katz, and to all of this, it's very challenging because of those factors. And as well as pastors, we have a lot of pastors, they're becoming super depressed. They're suffering with severe depression. Some of them are quitting, you know, because they feel like I can't help these people. I can't reach these people. And that's why we're even advocating for more churches to begin mental health ministries. Begin to get you some licensed professionals there, develop the ministry within the house, within the church. And so people need to see therapists. Yes, we're going to couple it with prayer. We're going to do that because it's proven spirituality. And of course, we used it in St. Elizabeth and they still do. Spirituality is a critical component of their treatment process because it has been proven that once you integrate spirituality with your care plan, they do much better. So we're trying to move towards that in the church. We're still preaching hope. We're still preaching things can change, things will change, but at the same time dealing with the practicalities and what people really have to face when they go home. No food. As Dr. Katz said, my grandson just got shot, you know, or someone, you know, I remember there was times and Bishop Staples often said, we're in the neighborhood over there in Ward 8, 2 members went to the church, 1 member called and said, Bishop, my son just got killed. The next member called 5 minutes later and says, Bishop, my son just killed somebody, and they remember children. So as the pastor now, you got two members, and one is the parent of the perpetrator and one is the parent of the victim. That's angst. That's a lot of anxiety.
Yes.
So that's where we are in the church, and it's become very, very challenging.
And thank you for sharing all of that, Bishop, because I think, you know, sometimes when you come from privilege because of your education background or your class background, and you see somebody in the clinic and they're not, quote, not doing what they're supposed to do, and you don't know that backstory, I think you know, like, oh, well, they're not going to do this or that, but you don't really understand what that is about. So the mental health piece is so crucial. I'm going to share an example with everybody. This is back in the early 90s during the height of the AIDS epidemic. My mother and I wrote an introduction to the Black Anthropology Journal issue that was dedicated to HIV in the African American community. And so they were looking at why young men did not want to use condoms. Guess what? They said, why should I use a condom if I'm going to be dead by 25 from gun violence? So that hope aspect, I think, is very, very important. And so what we don't want to do as, you know, the healthcare is to further exacerbate that by being less than respectful, by, you know, making sure that we see people and talk and say, I don't know everything about your life, but I want to be there and to be helpful to you. So this feels like it's off topic, but it's actually related to blood pressure. Yeah.
Absolutely. Because to the clinicians, and I used to say this to them in St. Elizabeth, one time we did a presentation and we have something in honor of one of the great psychiatrists who used to work there decades and decades ago. And one of the psychologists and psychiatrists came to me because we were on this team. And they said to me, they said, Chaplain, we trying to figure out, because there was an individual in care who had been there over 2 decades. Some things she disclosed to me, she never said to them. And I said to them, I said, because people want their clinicians to be caring, not saying that you don't care, but they have a sense of knowing when we're genuine, not when we're just trying to do it because of our educational endeavors and this is part of our curriculum and we're trying to succeed in this, but that they know that we actually care, that wherever we are in life, if I see you 10 years down the road, I still care about your well-being. And that is critical. And I said to them, I said, you know, because when you talk about the African-American community, oftentimes you hear them keep referring or deferring to Henrietta Lacks, right? To Tuskegee. And so you got to get past that. We got to, and you and I, when we did the town hall with the bishops and the physicians, we talked about that to try to help people move past that. But I believe that even as we're going to share on Thursday, I believe this is part of, and this is a great segue before we close, I believe this is part of us showing people that we care. We have the medical students, we have Dr. Katz, we have you, and those that will be joining us. We're letting them know because we're taking time out of our schedules, right? We're taking time out of our busy schedules to come and share because we care. And that goes a long way.
Yes.
That goes a long way.
For sure.
And we had Damar Hamlin. For the football fans, the whole world responded to Damar Hamlin falling on the football field. You know, and it was very sad that it took a life-threatening situation like his, because he had that foundation long before he had that experience. But I believe, being a spiritual woman, that it was divinely providential, that God let the whole world see it. And then people begin to see, oh, he's been trying to help those kids in the community. He's been trying to make the community better. So at that point, he had only raised $200,000. Once he fell out on that field, like in a matter of 2 days, he had like 7 million.
Wow.
And so I saw the other day.
Wow.
Yeah, I saw the other day, because what he did, he designated the funds and he has an organization handling the funds. And because he really wanted to get out into the community. So I think it's wonderful what we're doing on Thursday, showing people how to do compression only CPR, heightening people's awareness to hypertension and the problems that can develop from it. And you and Dr. Katz can speak to it far better. But I know so many, even some of my friends, that died from end-stage renal disease. And it really started with hypertension and it ended there. So many people on dialysis. And so we can't stop it, but we can try to help mitigate the devastating effects of these illnesses.
Mhm. And I would say that in Ward 8, there are only 6% of people who know how to do CPR. And these numbers come from the fire department. So getting people to know how to do compression only CPR is life-saving. Did the students want to talk about compression only CPR? Why did we move away from doing mouth to mouth and it's only compression only? Why did that recommendation drop?
I'm not sure they might have that historic perspective, but
yeah, that's right. You guys are too young. you just always.
I lived with that, and it turns out when you're doing that CPR, you're almost really moving the lungs at the same time, and you really don't need to do that. Just that the CPR, and we'll show the real simple basics of it to a group of folks that are available that just can keep people going. While first you call 911 and ensure that the people who can help the patient, and maybe we can get you a defibrillator in the building to have rapid recovery of care as well, because we really can quickly revive people and make them live for decades afterwards once we make that intervention. So we'll chat with a bit, but it'll be real simple basics to really get the patient in a quick transition till hopefully EMS people, emergency people come.
Yes.
And I also want to say, for anybody who's got children, please bring them out, because it's a nice thing to meet some, young doctors in training, some medical students.
Yes,
and
absolutely.
have those conversations and learn about, what it's like to be a doctor and why they chose to be doctors. So it's not only about the education, the service. These are some role models that they can meet. So,
absolutely.
yeah,
absolutely.
I know that.
And Dr. and Gigi, Dr. Albini, just let me sort of highlight what this young team is going to really be able to do, because we've had a bunch of community sessions and they've become really very adept at helping people. One, how do you really take a proper blood pressure? And by the way, if people have their own blood pressure cuffs, they can feel to bring it with them. If they don't, we can give them advice on where to get one and what and how to do it correctly. We're going to make sure you really understand that you've got to keep taking your pills. We're going to be giving out free pill boxes to everyone who is available, because it's so important to be organized, keeping a list of your blood pressures. We have some nice handouts that my team has decided that really are best for patients and our community, with regards to diet, with regards to how to monitor your blood pressure, and the other things to look for. And this is not necessarily going to be a one-shot deal. We'll be back. We are not necessarily your doctors on one hand, but on the other hand, we do want to really push you to really know how to communicate with your healthcare team. And if need be, our team here is willing to call back those people who really would like to need any help in making sure that we're worried about you, that we can make sure that you're getting the connection that you need.
Yes.
So these are the things that we really want to sort of show how to do it right and how to stay healthy. This is not very, very complicated, but it's just getting ourselves organized and the resources that you need and being educated will be really quite pleasant. And my students can comment on how rewarding it's been in meeting the community.
Yeah, please share with us.
Yes, we're closing out our last minutes. Come on and share with us, please.
For the medical students, how has it been when you've done events?
Yeah.
Hi, Mother.
Dr. Katz, it's been. Sorry, what did you say?
Would you like to share any last minute comments about how has it been for you all as medical students and serving in the community?
Hi, Mother. Hi, Mother.
Sure.
Hi, oh, I'm sorry, Pastor from India. You want to have something to say?
In DK Webb Medical College, after next month, I'm starting in India.
Wonderful. He's starting a medical college next month in India. Wonderful.
In DK Webb next month, I'm starting in India. Medical camp.
Great.
Okay, wonderful. Thank you for joining us. All right, to
Yes,
our
yes.
medical students, would you like to have some last closing comments as well?
Oh, yeah. So I was just going to say, we appreciate the opportunity. Blood pressure is the greatest, and Dr. Albaimi, Dr. Katz will tell you, it is the greatest risk factor for most kinds of cardiovascular disease. So if you think about everything, being very hypertensive is the top of that list. And so if there's one thing that you can control, optimally, you would want to control your blood pressure. And if you don't know it, you can't really control it. So we really appreciate the opportunity. It's great to meet people. And for myself and the entire team, we really thank all of you. So thank you so much for everybody else. Thank you.
Thank you.
Yes.
All right, Dr. Gigi, you want to close us out?
Sure. As always, Bishop Webb, we didn't even talk about the fact that we had a speaker series throughout COVID where
Yes, we did.
we would have once a week. And so I think we need to kind of resurrect those because we learned a lot from all kinds of different aspects, not necessarily only COVID. So
Yes.
I think what this activity is about is it is about bringing together committed, dedicated students with their faculty mentors that really want to serve and want to be part of the solution to getting blood pressure under good control. So please come on Thursday.
Yes.
You've got a blood pressure cuff, bring it.
5:30 p.m.
Right. And if you do not have, if you're not sure that you can get all the questions answered, bring a friend, bring kids. We want to see you. There'll be free pill boxes for you and some other swag. But thank you, Bishop Webb and Temple of Praise. I love you.
Yes, we love you all too. From my Bishop Staples, thank you all so much for taking your time out, and our new First Lady there, First Lady Sharon Staples. We thank God for all of you and thank God for those who have viewed and who will go back. And we'll see you Thursday at 700 Southern Avenue Southeast, 5:30 p.m. on Thursday. We'll see you there. Come get your blood pressure check, come get your goodies, and most of all, come learn life-saving CPR. Hands only, compression. 3 minutes of your time. All right? Wonderful. Thank you all so much for taking time out of your busy schedules, Dr. Katz, Dr. Gigi, and to all of our medical students, Will, Jacob, Bridge, and of course, to Pastor G from India. We love all of you. God bless you, and we'll see you next time.
Okay. Bye-bye.
Bye-bye.
Thank you.